Y'all are going to learn a lot during the segment. We learned a lot just in our break. We've already got Jack fixed, so this is great. But swelling in your hands, feet, and joints, that's one of the symptoms of rheumatoid arthritis. So this morning, we have Dr. Mona Idris and Lauren Munns here from SECOURS Rheumatology.
Exactly.
Okay, all the big words on a Friday. Here to tell us more about rheumatoid arthritis. And I didn't realize how serious and painful this was until we started learning more about it and hearing from you. And it's...
So rheumatoid arthritis is a very different arthritis from regular wear and tear arthritis.
Really?
So two main types of arthritis really in the whole wide world, non-inflammatory or inflammatory. Inflammatory arthritis means there's inflammation in your joints. You're not supposed to have inflammation in your joints. So it's like your joints are sitting in a pool of acid. Non-inflammatory is simply osteoarthritis, wear and tear. We're all going to get this.
Comes with age.
Comes with age.
Yeah.
Thankfully, it doesn't deform you, so you don't need to worry about it. I mean, it hurts, we can treat the pain, but this one is very different. So inflammatory arthritis, there's inflammation that's not supposed to be there. If it's not fixed, it will eat away at your joints.
How did how did it get there in the first place?
So that's the million-dollar question. So inflammation and what it's coming from, multiple sources, but mostly genetics. But you do want to fix that because you will get crippling and you will be very dysfunctional. I mean, it's day and night, the difference between the two.
My grandmother had RA.
Right, so I'm sure you remember.
And bones, rib bones, and this was 40 years ago, would actually fuse together.
Oh, gosh.
So that's exactly why.
Can't that happen?
Because there's deformities. When you start losing the cartilage surface, things start fusing together, and then you lose your range of motion. So everything starts fusing, everything starts eroding away. So very, very different from osteoarthritis.
Is there anything that we, being all of us, are doing that are maybe causing this?
So it's really good that you talk about this because there's nothing that you particularly or one is doing to cause this. But I get that question all the time from patients. And actually that's one of the things that we wanted to come and talk about today. We are starting at SECOURS an arthritis wellness clinic where we are going to be meeting once a month. And it's in the evenings between 6 and 8 where patients will always ask me in a 20-minute slot, what can I do to help this? What can I do? They ask Lauren.
Yeah, they just they have many comments of what can I do eating-wise? Healthy eating habits, exercise, what can we talk about? And like she was saying, with that 20-minute slot, there's only so much information that can be shared.
So we're going to be shifting to where we have this couple of hours every month where patients come together collectively and we'll talk at depth, whatever questions that they have, answering questions like what dietary changes would be helpful, what kind of exercise regimens they can accommodate with their different types of arthritis, what kind of other things that can make this worse, make this better. And not just that, coming together as collectively, you hold each other accountable. You're more likely to see it through. You're coming together, you're going to ask questions that somebody else didn't think of or somebody thought of it but didn't want to ask.
So diet really plays a role?
Absolutely, because it adds weight to you or lack of weight, or there are certain things that are more inflammatory foods versus non-inflammatory. So all of these things play into something that you can do yourself to help with your arthritis.
And there are things you can eat that help inflammation.
So your treatments medically, your medications are going to be the main target of that. But everybody feels like they want to have ownership of their disease and they can do something about it. That makes them think, okay, I'm doing something myself as well. And those are all your dietary, your weight changes, your exercise regimens, all of those.
Now this is going to be a 6 to 8 thing once a month at SECOURS.
Absolutely.
Do you have the first date for
Yes, we do. So January 22nd is our first date. We're super excited. So please just call. You do have to be one of our patients, however.
Okay.
So do please come check out our website and the phone number. We would love to have you there.
Will it be at your downtown or east side?
So we actually, our office is based off Roper Mountain Extension. So that's where this is going to be. If you Google, or I'm sure you can provide information about our location. But we would love to see you there and help you and work on. It's a new year. Who doesn't want to work on their diet?
And feel better too.
Everything.
Do you have a private practice, or everything you do is through SECOURS?
So no, everything I do is through SECOURS. Yes.
Okay.
I don't want to worry about running a private practice.
Right. Let them take care of it. It's a great.
Lauren will be there. And we'll have a dietitian on site, so you'll have the three of us working together to help you guys and answer whatever questions. And going forward, whatever comes up, there's so many myths out there about, you know, gluten-free diet can help with weight loss or this or that. So we want to kind of unravel all of these myths for you.
I love it. Make it in one thing. So thank you, ladies, so much. This is fantastic. Y'all take advantage
We're
of
lucky
this
to have
too.
her. There are not a lot of rheumatologists.
No.
You are absolutely right. We are
You're-
booked out very
yes,
far
yeah.
away.
And
Yeah.
they make it
thanks.
make sense too.
Yeah,
You know what I
yeah.
mean?
She's
So
a regular
yeah.
person.
They're good. They're good. We like them. Y'all don't move. We still have more. You're killing them. We'll be right back.